So today, they asked me, since most of the talks I've done predominantly been attended by women, we decided we'd try to do something to get the guys in here. The women agreed last time they'd stay out of here. So while we talk about men's health issues, although a lot of them really would want to come and so they could tell their husbands what to do. But all right, today we're going to basically go over 4 categories of concerns. One is just some typical health issues for men. I think I got this from some information that y'all had on y'all's wellness site. We'll talk about those very quickly. 10 tests I think men should consider having. Foods that can help you with a man's health, and then your body and your sexual health. So those are some of the things we'll talk about with men's health. 9 health issues. Hypertension, that's a big one. That's one of the most important things for people to treat if they have it. And the biggest thing is just get your blood pressure checked. We'll go over some of that in a minute. Cancer issues for men. These are 4 of the big cancers for men: lung cancer, skin cancer. Now, a lot of skin cancers don't kill people. Melanoma skin cancer can. The more common basal cell usually doesn't kill anybody. Prostate cancer is a big concern for men, particularly as they get older. And then colon cancer, colorectal cancer. These are the top killers of men. So, and if it's skin cancer is a killer, it's going to be the melanoma. So, obesity, that's a big issue, literally, isn't it? So, we'll talk about that some more. Actually, this is the number 7 cause of death in men. Most doctors know that if a woman decides to commit suicide, a lot of times she just kind of goes through the motions and she doesn't succeed. Usually if a man decides to do it, he pulls out a gun and gets it over with. So one of the things we want to do is we want to get men to acknowledge that they may need some help for that. And there's more about that later in here. Erectile dysfunction. This came off of y'all's information. I got that shocked me. I mean, I knew there was a lot of this, but only 1 in almost 58,000 websites are legitimate pharmacy. And I tell you, these illegitimate pharmacies, you'll be surprised what they put in drugs. Many times it's just junk, sugars, just something like placebo. But sometimes it's dangerous what they put in it. So, and I think y'all had a lot of information about illegitimate drugs, if you will, on that site for a lot of different things. So you always want to be sure you're going to a doctor. But there's even been concerns. There was even a concern at one time. There was a part of the country where they got a lot of Lipitor, brand name Lipitor, was bogus. They'd even made it labeled, they'd gone so professional, they made it look like real Lipitor. So the doctor and the pharmacist and the patient, everybody thought it was real Lipitor and it wasn't. Fortunately, somebody figured it out. Type 2 diabetes. 13 million American men have diabetes, so that's a pretty big number. High cholesterol. That's some of what I've been doing in a lot of my counseling sessions out here. This is one of the big factors in heart disease and strokes. Heart disease, number 1 for men, and number 5 would be strokes. Chronic respiratory disease, COPD, as we commonly call it. My biggest thing about COPD is don't smoke. People who don't smoke, actually, if you live to be really old, you'll probably get COPD anyway. Smokers just get it 20 or 30 years sooner. So, and breathing pollution, different things like that can cause us to have COPD. And some people have COPD from inherited diseases where they don't smoke at all. I mean, you hear of people who have emphysema and they never smoked. I had an aunt who did that. She had horrible lung disease and she never smoked. Her husband smoked like a smokestack, but so. Hair loss, that's another issue for men. We're not going to talk a lot about that today unless y'all have questions about that. But that's another place where you can really get a lot of bad things off the internet. Next, what are some tests that we recommend people do? Some of these you can do yourself. One is to weigh. Try to figure out what your BMI is. You may have to get a calculator to figure out your BMI. That's body mass index. There's a formula for it. Over 30 is considered obese. Over 40 is considered morbidly obese. And people who are morbidly obese have very, very high risk factors for a lot of things, diabetes, heart disease, but even being over 30. If you're a man who works out a lot and you've got a lot of muscle mass, your BMI may be okay, being a little higher than it says on those charts if you've got a lot of muscle mass. All right, but that's one you can do yourself. You can watch your weight and be sure you're trying to keep your weight under control. Blood pressure, it's pretty easy to get your blood pressure checked. But the key thing is to do something about it. You'd be surprised how many people get their blood pressure checked. They know their blood pressure is high. They never get it treated. A lot of them go to the doctor, start on treatment. Next time you see them, they're not taking the medicine. They say, well, I took the medicine for 2 months, my blood pressure was normal. It's not normal now. I mean, I've seen people actually ruin their kidneys doing that. Come back to see you 6 years later, blood pressure is 220 over 140, and their kidneys are shot, and you can't get them back. Fasting blood sugar. Now this is, you guys actually got to have that tested. Some of this you can get over the counter. Fasting blood sugar your fasting blood sugar should normally be less than 100. Between 100 to 125 is considered pre-diabetes. 125 and higher is considered compatible with diabetes. We don't diagnose it until you have 2 of them. An A1C tells you what's your blood sugar doing around the clock, not just when you're fasting. And there's some parameters for that also. So certainly if your fasting blood sugar is high, you might want to get your A1C checked. And this is more important for men as they get older. It's more important for men who are also overweight. It's important for all of us to find out what our lipids are, triglycerides, good cholesterol, bad cholesterol. And y'all are fortunate out here, y'all have a very good wellness program and a good health fair that gives you a lot of information about that. And if you're not taking advantage of that, you should. Skin examination. You can try to learn to look at your own skin, but it's important periodically to see your doctor. This is one of the things that hopefully your doctor can do when you do your physical. Of course, it helps to do it if people will be willing to get undressed so you can see their skin. So, this is an important one. If depressed, see a doctor. Because a lot of people are struggling with stress and depression and they don't see a doctor. Particularly, men are worse about this than probably women traditionally, because a man feels like he should be able to deal with it himself. And he doesn't want to go to admit to a doctor that he's depressed. Now, the other thing patients do, men and women both sometimes, they go to the doctor and say, I don't feel good. They don't say they're depressed. They talk about, this hurts, this hurts, this hurts, I just feel terrible, I can't sleep good. And the bottom line is many times they're depressed. A lot of the medicines we have nowadays treat depression. People feel a lot better and they tolerate them well and they're not expensive anymore. You can get Prozac for $4 a month or $10 for 3 months, for instance. It's cheap. And a lot of good medicines are very inexpensive. This test is a little more controversial lately. The U.S. Preventative Task Force, which does a lot of guidelines for the government, has no specific recommendation for doing a PSA or not doing one, and same thing about a rectal exam. What I haven't figured out from them is how the heck do they think we're going to ever figure out if a man's got prostate cancer if we never check his gland and we don't do a blood test? So that's a little upsetting to a lot of doctors that they have no recommendation to do it or against it. So they don't.
So what is your recommendation?
I think the PSA is a lot more useful particularly after age 50, if you get it done every year so that you're kind of following where it's at. The PSA is more inaccurate in men who have huge glands, that have big prostate glands. They jump all over the place. If they get a little infection, the PSA goes up. But if you kind of follow it year after year, you got a better idea what it's doing. And the rectal exam, the reason for the rectal exam is a couple of things. One, you can at least tell how big the gland is. Sometimes you can feel a lump in the gland and the PSA is normal. That's fairly rare. But at least those are probably the best 2 ways to even find prostate cancer. The questions can be, and where it's gotten so controversial, is sometimes you find it in an 80-year-old man, you're doing this and you find he's got prostate cancer, the best treatment for it is to do nothing. But now, the guys I see in here at y'all's ages, if you've got prostate cancer, you need to know it and you need to have it treated. Or at least monitored enough to be sure you treat it when it progresses to a certain point.
My cousin, he's probably 43.
Right.
He just went last week and found out he has stage 3 rectal cancer.
Yep.
So he's, they said the prognosis isn't good.
No, it's not. Well, and he's before the general age, unless he had a family history of recommending doing a colonoscopy, which that's one of the tests I think we're going to get to pretty quick here. Colonoscopy after age 50. Now, again, he's before age 50. When you look at when you recommend a screening test, y'all familiar with bell-shaped curve? Do you remember that in school? Like this? You got to have so many people having a problem to recommend it for screening. He fell below the 50. So there's not enough people in his age group having it for people to recommend you screen for it. Which the big thing for a patient is, let's say you're 40 years old and you said, ooh, he had that, I want to go get a colonoscopy done. Your insurance company probably won't cover it because that's not a standard recommendation. Doesn't mean you can't purchase it. But the chances of finding it in a person 40 years old is very low. He just fell outside the guidelines, which is not a good thing. Now, people in his family should be checked at earlier ages. CT scan of lungs for smokers. This just came out. Actually, the U.S. Preventive Task Force recommends this, almost with some reservations. Screening, this is for people, including men and women, 55 to 80 who have a 30-pack year. If you smoke 1 pack a day for a year, that's 1 pack year. If you smoke 2 packs a day for a year, that's 2 pack years. So if you have a 30-pack year of smoking and you currently smoke or have quit in the last 15 years, just calculating that, then screening should, and then you keep screening until a person has not smoked for 15 years. If you're 80 years old and looks like you're about to drop dead anyway, there's no need to. If you can't have surgery, so people who can't have surgery, there's no need to do it, because the only thing that cures lung cancer is surgery, and you've got to find it early. We learned a long time ago chest x-rays were not finding lung cancer early. By the time you could see it on a chest x-ray, most of the time your patient already was a goner. That's why we keep trying to tell people not to smoke, so you don't have to tell them they're a goner. So the recommended screening, if you're going to screen for lung cancer, would be the CT scan. Problems with CT scans, they see a lot of things. They're going to see, if they see a little spot, they're going to keep checking periodically. But even here, they recommend you do this, if you're still smoking, to do it once a year, so you can catch it early. Insurance companies right now, I think that's what this says right here, they don't typically cover it. Just because somebody recommends doing it doesn't mean it's covered by insurance. So one of the things, sometimes when things aren't covered by the insurance, one of our local hospitals, I think Piedmont Henry, is doing it for like $99, I think, which is pretty cheap. Hopefully none of y'all are in that category, but if you are, you would want to consider doing that. And the last one is, this is not every man should have, but men, again, this is going to be for smokers. Medicare does cover this for men 65 to 75 for aneurysms. The bad thing about aneurysms, a lot of times if you don't know they're there, if they pop, you die before you can get them fixed. There are people who have these before 65. Again, this is kind of the bell-shaped curve. Where can we get the most bang for our buck? By trying to save lives. And what they recommend is men, just men, not women. This is not for women. This is only for men. Between 65 and 70 who've ever smoked 100 cigarettes. There's a lot of men smoked 100 cigarettes in their life. So if you ever smoked 100 cigarettes in your whole life, when you're between 65 and 75, they recommend being screened. Now, men who, I'm sorry.
But I had read something saying that if you've gone so long.
15 years. Yeah. If you've gone 15 years, they don't recommend. Well, that's on the CT scan of smoking. It's not for this one, though. No. Not for this. That was on the CT of the lungs. There's not one on this one, though. Now, this is recommended as a one-time thing, and actually, unless they find an aneurysm. If they find an aneurysm that's maybe small, they may want to check it every 6 to 12 months. But, you know, you could be a man who, you could die at age 64 with a ruptured aneurysm. You could die at age 62. But the people who are typically going to get aneurysms are men, smoke, and have high blood pressure. And if they got diabetes, that's another kicker. So. And the other thing, too, as far as your doctor doing a physical on you, if you've got a real skinny man, you might feel an aneurysm in his belly. If you've got a man who's overweight, you don't have a prayer filling it. I mean, it'd have to be huge to fill it. So that's the other disadvantage sometimes of being overweight. It's a lot harder to find things on people who are larger, especially in the abdomen area. All right. Next, let's look at some foods that can help with men's health. Men are different women in what we need. We need foods that help us with muscle mass, prevent prostate cancer, among other things. A healthy diet, regular physical activity can help us prevent heart disease and cancer. Both, that's the number 1 and number 2 killers of men. And also, if you're eating right and you're exercising and you're eating healthy, you can do better in the boardroom or the bedroom. And depends on which one of those you think is most important. And this is, any food that's probably good for your heart is going to be good for your you-know-what, because it's all about blood vessels. It's all about blood flow. And of course, 10 foods. We're going to talk about 10 foods that are good for you, but there's a lot of good healthy foods. So if you want to live a healthy lifestyle, if you're smoking, you're not living a healthy lifestyle. I don't care what else you're doing. You got to quit smoking to say you're living a healthy lifestyle. So you want to not smoke, regular physical activity, and try to eat a healthy diet to give yourself a chance to not only live a long time, but to enjoy the life you're living to its fullest. Now let's look at some of the foods. Number one, oysters. How about that?
All right.
So oysters are very high in zinc. That can help against prostate cancer. It can help sperm counts, which as we get older, we don't really care about that anymore. The one thing I wouldn't eat, let's see, I don't think we had that on there. I would be careful as a physician. I wouldn't recommend men eat raw oysters. I know a lot of people love it. My kids eat it. There's a vibro infection you can get that can really make you sick. Anybody ever gotten sick from eating raw oysters? That's good. You do have to be careful about that, though. If you ever do eat raw oysters, you get sick, get to a doctor quick. There's an antibiotic that may save your life. So, and let them know you ate raw. Let them.
Food that make you feel better.
That's right. That's right. Don't eat it raw. The key thing is don't eat them raw. Don't eat them raw. Bananas, good source of potassium as well as a lot of other things. Magnesium, B6. So they help a lot of things. If you don't like bananas, here's some alternatives: orange juice, milk, tomato products, beans. They give you some potassium. I think even avocados give you potassium, if I remember right. Fatty fish. One diet that's a very good diet, particularly if you've got any cholesterol issues, is the Mediterranean diet. It's high in omega-3 fatty acids. And that can also help with prostate cancer as well as other things to do. Anti-inflammatory properties may help.
What is a fatty fish?
I think we've got those here somewhere. Salmon, sardines, tuna, mackerel, herring. Wild salmon's the best. Those are good sources right there. Also a good source of vitamin D. Most of us, you get your vitamin D from being out in the sun if you don't wear sunscreen. Then you get skin cancer. So what I'm doing now, I take a multivitamin that has vitamin D in it, then I take another 1,000 international units of vitamin D3 every day. We're now finding out that vitamin D, the body uses vitamin D not like a vitamin, it actually uses it like a hormone. It not only helps your bones, which you've known about for years, it actually helps your muscles. So if you want good muscle health, good muscle contractility, be sure you keep your vitamin D levels up.
How do you check for vitamin D levels?
Blood test. It's on y'all's blood test, isn't it? Or is it?
Yeah.
Isn't it on there?
I get 'em from my-
I think it is, yeah. I think it is on there.
I had low for a long time.
Yeah. Yeah, you'd be surprised. Well, we don't have any African American men, but African Americans very often get low because they don't do it through the sun the same as we do. Because they got all that melanin pigment. It cuts down their vitamin D absorption, conversion. All right, now this shows you some other things with omega-3. Flaxseed, walnuts, soy, canola, sometimes eggs. Broccoli. I was glad to see this one when I was doing this study because there's a local restaurant that I tend to eat in quite a bit. PJ's on the square, if y'all know where that's at. And if I forget to order broccoli, they bring me some anyway. But I almost always eat broccoli there. Broccoli is a good source. They don't mention it here. It's also a good source of calcium. It's got vitamin C, beta-carotene, potassium. And it's got some anti-cancer properties. So broccoli is a good food. If you don't like broccoli, you can do some of these other ones. Let's see. I don't know if did she put it on the slide? Yeah, here we go. Broccoli, slaw, cauliflower, Brussels sprouts, cabbage.
You got an opinion on how it should be prepared? I mean, my understanding is
Right.
raw broccoli is not good for digestion.
Yeah, the broccoli I guess I'm eating there, it's not raw.
Steam.
Steamed probably, yeah, it's steamed. That's probably so. Yeah. Yeah, now the one way you shouldn't do it is to fry it. Now, my wife recently started taking Brussels sprouts and she's kind of blackening it with some olive oil or something. And it's really good. I don't know the whole recipe. I'm not much of a cook. Brazil nuts. You don't want to eat too many of these things. They're pretty big anyway. 1 to 2 a day. And they have a lot of magnesium and selenium. And selenium can help with your cholesterol. And here's some other choices that will help too. Dry roasted nuts, tuna, turkey, shellfish. Whole grains. As long as you don't have a gluten problem. Gluten-free diet's kind of a fad right now with a lot of folks. There's a lot of people on gluten-free diets that are not really gluten intolerant. However, I've had some patients who've done it just for a diet, and they tell me their digestive system felt a lot better while they were on it. They didn't bloat as much, and they actually felt good on a gluten-free diet, even though they don't have celiac disease, which is people with celiac disease should eat no gluten. So, all right. Another good whole grain is oatmeal, barley, things like that. Other sources of fiber: apple, pears, and beans. Apples, particularly if you eat the peeling. So, plant stanols, and this explains what those are and some of the products where you get that. The bottom line, if you start looking at what's healthy, you need to be eating fruits and vegetables. And if you go out to quick eat restaurants, what's the one thing you usually don't see there? Fruits and vegetables. You know, it's usually French fries and a burger or a hot dog or a piece of chicken fried or something, or barbecue. You know, it's hard to get good vegetables when you eat out. And then if you do get to a vegetable place, guess what they do? A lot of times they drop pork in it, fat back. So they make vegetables which are healthy, unhealthy. So you have to watch for that. Soybeans, they have isoflavones. That can protect the prostate and lower prostate cancer risk. Just 1 ounce a day can help lower the cholesterol. Berries and cherries. They have this anthocyanin in them. But look at this. It says here, berries, this was interesting. I thought they have 4,000 different compounds that are antioxidants. Antioxidants are a good thing. We need antioxidants in our blood to help cut out a lot of the crap we have. And adding berries to the diet might even help your brain function. So blackberries, blueberries, strawberries, raspberries, cranberries, and cherries. One of my favorite foods in the morning, I eat oatmeal. This morning I had oatmeal. I sprinkled cinnamon on it, which is good, and it may help your blood sugar. Put blueberries on it. I use Splenda. I don't put it in milk. I used a little Splenda on it to sweeten it just a little bit. In addition to eating a bowl of fruit. So, for protein, I did eat. I ate a couple pieces of turkey bacon. I'm allergic to pork, but it's probably not good to eat pork bacon anyway. So turkey bacon is a little better choice. But actually, I looked one day, and oatmeal had more protein in it than the turkey bacon, which surprised me when I looked at it. I would have thought the turkey bacon would be giving me my protein since I'm eating this grain of oatmeal, but it actually had more protein in it. Red orange vegetables, getting vitamin C, beta-carotene, again, antioxidants. 1 red bell pepper, better than a green pepper. I guess, I don't know what the green pepper does. Everybody recommends red bell peppers, but it's got a lot of vitamin C in it. Carrots, pumpkin, sweet potatoes. Sweet potatoes are a much better choice for us than baked potatoes. There's actually less carbs in a sweet potato than a baked potato. A baked potato is a starch. When you eat it, it turns instantly to sugar. It's the other problem with French fries, particularly if somebody's got diabetes. If they're eating French fries, they're eating a potato. As soon as it gets in your stomach, you're getting the fried stuff, plus you're also getting a quick surge of sugar. And I've told people, French fries and baked potatoes don't taste sweet at all, do they? Turn right to sugar. Any starch, your body will turn right to sugar. So that's where we have to watch it. The sweet potato, your body, anytime what you want your body to have to do is to work a little harder to digest something. The harder it has to work, then the more likely it is it's going to slow down the conversion of everything to sugar. A little trick you can do, if you are going to eat your baked potato, do like I said, eat broccoli. The broccoli will help slow the baked potato down, the digestion of it, because you've got the broccoli in the stomach with it. So, some little things, you learn how to manipulate your foods to make yourself more healthy. So these are just 10. You could do a lot more on nutrition. But next, let's look at your body and sexual health. How are we doing on our time? I guess we're doing okay. One of the things that men may notice, some of you here are old enough you could relate to this. As you get older, certain physical changes impact your performance in the bedroom.
No, I don't have this problem.
Okay, that's good. That's good to know. Usually the person who says they have no problem, you need to ask them, well, what is your problem? All right. It may be there's nobody there but you. And I don't know the answer to that question. All right. Several things can happen. I hope that as we get older, we don't talk about sex as much as a teenage boy does. But your erections may not be the same. Your response may not be the same. I mean, I think most of us can remember being a teenager. All you had to do is, if a pretty girl just walked by, you had a little buzz or something, right? Or are you like, oh, okay. The salute below the belt kind of thing if she was really good looking. All right. So what's some ways to restore your sex life as you're aging? And one of the things to look at is low testosterone. Now, some men have normal testosterone and have erectile dysfunction. And some men have low testosterone and have no erectile dysfunction. That's interesting, isn't it? After age 40, it's normal your testosterone is going to get lower. That's part of the aging process. Now, it can vary from one man to the next.
What do you want it to be? I have mine tested. I don't know.
It depends on the lab. Somewhere between 300 to 1,000 is normal. And before you diagnose it being low, you want to at least have 2 tests, and you want to be tested early in the morning. The reason you want to be tested early in the morning is that's when it's the highest. So if you're low when it should be high, you're low. Now, and then there's still a lot of controversy whether you should treat it even when you're low, because you got to think about some of the risk of taking testosterone, and I'm going to talk about that a little bit in here. Erectile dysfunction, it becomes more common as men get older. If you want to just roughly, I read one time statistically, at age 40, 40% of men have some ED. 50, 50%, 60, 60%, 70, 70%, 80, 80%, 90, 90%. By the time you're 100, you're washed up and no good. So at 100, it's 100%. Thank goodness they developed medicines that help a lot of times. Oops, went too far. So another issue is for men is the age. This doesn't happen to all men. You know, for the men it does happen. You know, as we get older, a lot of things shrink, but the prostate, unfortunately, grows, and that's not a good thing. And but prostate growth can be a normal part of aging, so it does generally get a little larger as we get older. And there's chemical hormonal reasons for that. Having an enlarged prostate is not cancer, and it doesn't even make it more likely. It can make it hard to urinate, though. That's what the problem men with BPH have, is they can't pee sometimes, or they pee too much because they can't empty the bladder good. What are some overall ways, how can you stay vital as you get older? Exercise. Regular vigorous exercise helps the heart pump blood. It's important for sex because it's all about blood flow. So a workout 20 to 30 minutes a day will help a lot. It can be helpful. If you're not used to exercising, it helps to start slowly, particularly the older you are. If you're over 45, it's generally recommended to have a physical or at least talk to your doctor about it. Brisk walking is good. The other thing that's good for health, though, for instance, if you want to lose weight, one of the reasons is the people who have trouble losing the weight are the people who are the heaviest. And there's a reason for that. Their percentage of body fat is very high. And if your percent of body fat is very high, it's hard to lose weight. So the best way to do it, to try to do it, is to try to become more fuel efficient. You need to increase your muscle mass. Walking is a good exercise. That'll help your leg muscles, but you want to help your arm muscles. So actually working out some to strengthen your muscles as you get older will help your metabolism a lot and help your muscle mass and make your body more fuel efficient. Eating right is another good way to keep yourself vital and help protect against things that do hurt. These all affect sex: diabetes, obesity, heart disease, high blood pressure. Sometimes medications you have to take for conditions you have can affect sex. Lose weight. Too much fat can lead to clogged up arteries and poor blood flow. Poor blood flow and the penis is not good. It won't work. All right, stop smoking. Men who smoke are twice as likely to have ED as non-smokers. And there may be a lot of reasons for that. One would be cholesterol issues related to smoking. So smoking has an adverse effect on that. Did I miss one here? Ask for help. This is the other one too, again, getting back to depression. Because most people, when they're depressed, they're stressed out, they're anxious, they're usually not going to be performing very well sexually. Chronic stress can affect that, and so it kills your libido. Sleep well. This is interesting. Missing sleep can slow down your sex drive and lower your testosterone. So one of the things you might do if your testosterone is borderline, but you're only sleeping 5, 6 hours a night, change that to 7 or 8 hours a night. See if your testosterone levels will go up, in addition to doing some working out. Check your medications. Certain medications, some blood pressure medications, a number of medications can cause problems. Chronic problems don't appear overnight, they build up over time. See your doctor regularly, learn how to work through that. So get checkups is important. And generally speaking, as men, we're more notorious about not seeing the doctor for checkups than women are. Although I see a lot of folks who are very good about doing it. So, all right. What about low T though? There's a lot about low T, and now the lawyers are all over it. Since one study came out and showed some problems, the lawyers want to, if you take testosterone and you have any health issues, they want you to join a class action lawsuit against people who make the testosterone medicines. And the reason for that is the companies that make testosterone medicines make a lot of money. And lawyers want to get the ones that make a lot of money. At least those kind of lawyers do. Let's look at some of the questions. This is on your handout. Do you have a decrease in libido or sex drive? Doesn't mean it's low T. Do you have a lack of energy? Well, while low T can cause a lack of energy, a lot of things cause a lack of energy. One of the things that's obvious in these questions to me for low T, a lot of these questions are made by the people who make the testosterone and definitely want to sell them. And I noticed that the questions are very vague. Lack of energy. Probably the number one complaint I've heard from patients for years, in 30-something years of practicing medicine, is they're tired. Everybody says they're tired. So lack of energy is a prevalent problem. Decrease in strength or endurance. Well, I've been practicing medicine for 30 years. My strength and endurance is not what it used to be. But I don't know that, when I've checked my testosterone, it's been okay, but maybe I'll check it again. Have you lost height? Well, if you've got deteriorating disc, you're going to lose some height. As the fat pads on your feet wear out from standing all the time, you're going to lose a little bit of height. So there's a lot of reasons we lose height. But testosterone does help bones. So if you lose it because your bones have been deteriorate, and I think that would apply more probably to men who are in the retirement age group. Have you noticed a decrease in enjoyment of life? That's a multifactorial thing. A lot of things can affect that. Are you sad and grumpy? And that you might look at it. 30 years ago when you had good testosterone, were you sad and grumpy? If you were, you're probably not testosterone. Are your erections less strong? That could definitely be related to testosterone. Although again, you could have normal testosterone and have erectile dysfunction. And a deterioration in your ability to play sports. The last time I looked, there's no guys my age playing any major league sport at all, except maybe the senior tour on golf. And even the senior guys on golf can't compete with the young guys anymore. That's why they got their senior tour. So we all do deteriorate in our ability to play sports because we're aging. But if you a year ago were going out and say you were playing tennis and you were a pretty good player, now all of a sudden you can't slam a drive or anything anymore, or your golf game's deteriorated, maybe your testosterone level's dropping. Are you falling asleep after dinner? Well, I think we all sleep after dinner, don't we? I guess they're saying, do you fall asleep within the few minutes after you eat dinner? I don't do that unless I sit in a recliner. Feet go up, eyes go down, eyelids go down. So I figure it's from working hard. But the bottom line is what they're saying is a lot of times if you sleep, you get sleepy easy, then maybe your testosterone's low for a man. Deterioration in your work performance. That's another possible indicator. What is testosterone? It's a hormone. Fuels the sex drive and muscle mass for men. Regulates our mood, bone strength. What gets below normal, what can we do? Shots, gels, patches. Actually, even now there's pellets that some people are putting in. Debate over who needs treatment. We all know that testosterone dropping over time is normal. You can call it andropause, male menopause. And actually men can even get, look at here, men can get hot flashes. Irritable moods, less interest in sex. Testosterone, if you find yourself thinking about sex a whole lot, your testosterone levels are probably pretty good. It's a general rule. If I could ask one man, the man says, I don't even think about sex anymore. I don't want to do it. I don't even care. Well, if you're still very interested in sex, usually your testosterone is what's driving that. Some of the things you'll notice with low testosterone: thinner muscles, loss of body hair, smaller, softer testicles. A lot of times older men, their testicles are very, very small. And it's because it's part of the aging process. And larger breast. And it's because you don't have as much testosterone to compete with the estrogen. All men have estrogen. But if it gets out of balance, you can get larger breast. Smaller testicles and larger breasts. You get to looking less like a man. And if you look, the same thing happens to women. Women, when they lose their estrogen, they start looking more like men than women. I mean, it changes for both of them. Because, again, it's because their estrogen to testosterone gets out of balance. So we get more looking like each other as we get older. All right. Real reassuring about aging. And as testosterone falls, the bones can get thinner, weaker. Osteoporosis is a big issue for women, but it's also an issue for men. It's usually at an older age. But men can have osteoporosis and hip fractures and all of that as they get older. And it's usually related to this, part of the aging. A drop in testosterone is important to know, doesn't always interfere with sex. One of the things, I don't know if they've got it on here, low testosterone can make it tougher to keep an erection, irritability, mood changes. One of the things that's normal for men is your testosterone drops, and as you start having a little issue with ED maybe, is a man may need more stimulation, foreplay. I mean, usually you think of foreplay when you're young, that's for the women. Actually, later on it may be for the men. So a lot of that's knowing how to handle that situation. Other health problems can create some of this too: depression, anemia, chronic illnesses, sleep disorders, sleep apnea. That's another big one for men, particularly for men overweight. This one, if you're worried about fertility, testosterone does help us make some sperm. So if a younger man's having trouble, you might want to check his testosterone level. Especially if you are checked. If a couple's having a problem having a child, probably the cheapest, easiest test to do is to do a sperm count on the man. That's a whole lot less expensive than doing all those other tests on the woman. Because if it's the man's sperm count's low, you know what the issue is, or probably what the issue is. All right. The number one reason you get low testosterone is because you're aging. Illnesses can do it too. Type 2 diabetes, liver or kidney disease. What's one of the number one reasons men get liver disease? Alcohol. And alcohol is not good for you as far as that goes. COPD. And number one reason you get COPD? Smoking. So if you're a heavy smoker and you drink a lot of alcohol, you got a whole lot of problems coming. Pituitary gland problems, those aren't all that common. Injuries to the testicles. Radiation therapy, and that can be a problem like men who've been treated for prostate cancer. Chemotherapy, steroid medicines. And in fact, people who are working out who get huge, a lot of times if they're taking anabolic steroids, they knock out their own body's testosterone drive. So they have to be, it's risky. Your doctor may suggest a testosterone test if you have any of these issues going on. It's usually in the morning. There's the normal level you were asking about earlier. And the second one should be done before you diagnose it to be sure. Several forms of therapy. A lot of them are advertised on TV, the topical therapies. Pills of testosterone have a real inherent problem. The testosterone to be broken down has to go through your liver, and it can create some liver disease issues. So that's why we're looking for other forms of treatment. A lot of these testosterone patches and gels are extremely expensive. So a lot of insurance companies won't cover it, so men end up resorting to the cheaper treatment, which is injections. Here we go, injection. Problem with that, the injection is you give the injection, boom, your testosterone surges up, and then over the next couple of weeks it starts to come back down. That's why you have to keep going back and getting shots. A patch, Androderm's the name of one of them. The patches and the gels give you a more steady state of testosterone, which is a good thing. That's one of the gel is like Axiron, you see that advertised on TV, Androgel. You have to be careful sometimes about transferring it to another person because you don't want women and children shouldn't be coming in contact with a lot of extra testosterone. So I've never had anybody use this one straight out the buccal mucosa where you put it up in between your gum and your teeth there. Pellets, I've known some people who've done that. Those are implanted. You have to replace them though every 3 to 6 months. And that might get to be a little bit. That could be expensive, but it also gets a little irritating to have somebody cut into your skin and plant a pellet in you every 3 to 6 months. I haven't seen a lot of people do that one yet. And this talks here about, well, not recommended orally because of liver issues or other significant liver issues. Now, some of the risk of testosterone therapy contribute to sleep apnea, stimulating non-cancerous growth of prostate, but prostate cancer is also an issue, enlarging the breast, limiting sperm production, stimulating the growth of an existing prostate cancer. So the problem you have, if you got, statistically speaking, and I'm going back to my days when we took pathology, if a 60-year-old man comes to see you and he's got low testosterone, there's probably a 50 to 60% chance that somewhere in his prostate gland he's got a prostate cancer cell. May never kill him, may not even be significant, may not even drive the PSA up. But testosterone, it's almost like our bodies were made for, as we got older, where we might get prostate cancer, our testosterone level drops, so if we have prostate cancer, it doesn't grow very fast. But if you've got some prostate cancer cells and you give the man a big surge of testosterone, it's like fertilizer. So this is one of the big issues for older men taking testosterone therapy. And I've actually seen that happen. So it's a real risk that every time, it's one of the, I really think that all men would do better physically, probably even mentally, if they all took extra testosterone as they got older. I also think women would do a lot better if they took estrogen as they got older, because it's going to make you more like you were when you were younger. If you could alleviate all the side effects and the problems. It's hard for a doctor to recommend that, because if a woman gets breast cancer, you know, you're in trouble. If a man gets prostate cancer, you're in trouble. So it's very difficult as physicians to sometimes recommend. I think those things would be good, but you have to understand there's also risk. You may feel better, but you may die sooner. And you may say, well, I'd rather felt bad and lived to 85 than to die when I was 69 with prostate cancer. So anyway, if you do have low testosterone, you want to go over whether to replace it. You also want to keep watching the level, because you don't want to be Superman. You don't want to try to get those testosterone levels up sky high, particularly as you're getting older, because of the possible side effects. If you have sleep apnea, and that may be on here, this is some of the drawbacks. Some men may develop these things, and red blood cells, so you ought to watch your blood counts, enlarged prostate, acne, prostate cancer in older men. So you need to be checking for those things. You need a PSA. If you're going to take testosterone and you're a man over 40, I would probably have a PSA done before I started it, and 6 months later I'd look at it again. Now, the only problem I have recommending that to patients is insurance may not cover that. Why'd you do a PSA twice in a year on a guy in his 40s? It's because I want to be sure I didn't stimulate prostate cancer by giving him testosterone. So, because there are men in their 40s who get prostate cancer. Who should not take it? Obviously, if you've got prostate cancer or breast cancer, you shouldn't take it. If you've got heart disease, you shouldn't take it. If you have untreated sleep apnea, you shouldn't take it. And if you've already got a high hemoglobin hematocrit, where your body's got too many red blood cells, you shouldn't take it. So, now, does anybody know what common things people do that can make the red blood cell count get higher? Red blood cells carry oxygen. One of the things that people commonly do that makes their oxygen levels, that adversely affects their oxygen levels, is smoking, because it's affecting their lungs. Their lungs don't work as well. The body is always trying to compensate to make things better. So what the body will do in a heavy smoker many times is all of a sudden you'll notice that their hemoglobin, their blood count, the opposite of anemia, their blood count starts to climb. And that's because the body's developing, putting out more hemoglobin to carry oxygen so they can breathe. But that would be a reason you wouldn't want for that person to give them testosterone, because their blood count's already high. If your blood count gets too high, you're in danger of strokes, because the blood gets clogged up and is not moving like it should. Low testosterone is only one of the causes of low libido. And libido, basically, most people I think know what libido. Libido means interest in sex, okay? You can have good function, but have no libido. So, stress, sleep deprivation, depression, chronic medical illness, all those can sap your sex drive. Low testosterone by itself rarely causes ED. It's one of the contributors. Actually, low testosterone alone with no other health problems, only a small minority of men can you blame the ED on that. And for ED, and there's the one I've got y'all a thing on. If you're interested in some of the things people try for ED, actually, if you look at this list, the DHEA got a rating as being safe at low doses. I don't know how helpful it'll be at low doses. It's one of the things over the counter. L-arginine, I've seen a lot of doctors who are big on using supplements talk about men taking L-arginine. Just like Viagra, though, it can cause flushing. It's a vasodilator. Most of these others I wouldn't take. This has been used for years. It doesn't really work all that good. It probably have to have it in combination therapy. And some of these things you need to be very, very careful about taking them if you are taking Viagra and stuff like that. I like the name of this one, horny goat weed. It's even named, you know, horny goat. I guess somebody knows some horny goats were eating that weed or something. It may lower the blood pressure, and if you already taking blood pressure pills, that may not be good. And y'all have got those. Y'all can read those later. These are the more common medicines that we know about: Viagra, Cialis, Levitra, and Staxin. One of the things I think that I noticed changed in medical practice and family practice is for years, most men would not talk to you about their problems if they were having problems with sex or erectile dysfunction. Once they knew there was a medicine that could help them and they didn't have to go see a surgeon for some kind of surgical procedure, you started realizing, hey, this is a fairly common problem. That's why these drugs are big sellers. Hopefully one day Viagra will go generic. It's been around a long time, but it's not generic yet. All these basically work the same. They all have some of the same side effects: flushing, nasal congestion. You don't want to take it with nitroglycerin. Cialis is the longer acting. You also don't want to overdose on this. There was one reported case, some young man took 20-something Viagra. I guess he was going to be Superman. He was super dead because his blood pressure probably bottomed out on him. They couldn't bring him back. And they enhance nitrous oxide, which relaxes the muscles in the penis and increases blood flow, and that's what causes an erection. That's how they work. I mean, there's science to why these work. Viagra, actually the chemical in Viagra was around in the 50s. It's a vasodilator. It was a blood pressure pill. And I'm thinking probably there's a lot of men that really missed that after it was taken off the market. I don't know why they didn't keep it. But those are the common, headaches are a very common side effect. But usually men will take a headache for good sex, and women will say they have a headache so they don't have sex, right? That's what I'm doing. For a man, I don't care if I got a headache. All right. Other medications, there's injections. You actually, it's a tiny little needle, you inject this chemical right into the penis. I haven't found that very popular with most men.
Now that'll give you a headache.
Yeah, I don't know. But if you look at the guy who's in the newspaper, I don't even think he's a urologist or an endocrinologist. He advertises in the sport page. There's a doctor in the sports page. Actually, this is what he does when men go up there. If you've already tried everything else, he's going to put a shot right in your penis and tell you this is how to do it. And any other doctor could do that too. It's just, it's not the favorite. If a pill works, most men don't want to put a shot in their penis. There's also a suppository. This is called Muse. I never found that to be very popular either. You have to actually take that suppository and stick it right up into your penis, and it'll give you an erection. But testosterone replacement may be helpful if it's low. Penis pumps and implants. They actually make a pump whenever you're ready. You just pump it up and it's working. And then they have some that are like have an erection all the time. I don't know why you'd want to do that. Blood vessel surgery. I don't know of anybody that I've ever seen that's had blood vessel surgery for that. I'm sure somewhere somebody's had to have that because of bad vascular disease, and that maybe a vascular surgeon could help them out. Psychological counseling, because a lot of times it's related to stress, anxiety, depression, maybe something to do with the relationship of the two folks. And it can be worsened by lifestyle choices, things you can do to help. If you smoke, quit, lose weight, get regular exercise, get treatment if you got alcohol or drug problems, and work through relationship issues. So that's basically it. That's 1 o'clock. So do y'all have any questions that y'all want to ask? I mean, we asked some along the way.